Assalamu alaikum, Ultrascan Diagnostics here. This is the CBCT of the patient that you had requested. The area of interest is full mouth implants and whatever implant placement is possible. We've got two premolars on the lower left side which have periodontally compromised, so they will need to be extracted. This is the panoramic view. Unfortunately, we don't have any bone in the maxilla, which we will show you on the transaxial view, which is basically the proximal view. And starting from the back here, we can show you very comfortably. So this is the maxilla, and this is the maxillary sinus. Again, you can see we've got no bone. Even for a lateral window approach, the doctor will need to be very careful, as immense amount of bone grafting will need to be done, approximately this much to accommodate even a shorter implant. This is the molar region. As we move on to the premolar region, we've got very thin ridge here, 4.3 millimeters and approximately 6.9 millimeters. So this region, the first premolar region, and between the canine region, a shorter implant might be able to be placed. Then moving to the anterior region, we've got again very thin ridge and a very short ridge. So implant placement is going to be challenging here. So bone augmentation in the maxilla is absolutely critical for future implant placement. So this is the left hand side of the maxilla. Again, only have 4 millimeters of ridge height and only 3 millimeters of ridge width. The premolar region, we've got very little bone, 3.7 millimeters of ridge width with only 5 millimeters of ridge height. So here even a shorter implant will not be possible. Moving to the premolar region, we've got certain bone, 4.4 mm of width with 7 millimeters of height. So we try placing a shorter implant here, but again, this is an area which is very devoid of bone. This is the molar region, and again you can see the maxilla is completely atrophied, and we've got no crestal bone, no ridge present. So lateral window is the only option in the posterior region. So this is the premolar region where we can try placing an implant right here, where the width, sorry. So this is the second premolar region. So we'll try placing a shorter implant here, but we will rely on the doctor's clinical experience to analyze if this placement is suitable for implants for this patient. In the mandible, so the posterior mandible, distal to the mental foramen, we've got good ridge width, but we've got minimal bone height. So we would advise placing implants anterior to the mental foramen. As you can see, we've got very good ridge width, 9 millimeters with approximately 11 millimeters of height. In the anterior region, again, we've got very good 6 millimeters of width with 10 millimeters of height. In the lower left anterior region, this is the lateral region, you've got approximately 8 millimeters of width with a good 8 millimeters of height. And in the canine region, you again have very good bone, 9 millimeters of width with 11 millimeters of height. And moving slightly to the premolar region, again we've got very good bone, 9 millimeters of width with 12 millimeters of height. So we've got good bone in the lowers, and for implants, for an implant supported denture with a complete denture in the upper jaw, is a suitable treatment plan for our patient. So here we've placed 4 implants. You can place an additional implant in the center of the ridge as well, but these 4 can easily support an implant supported prosthesis such as a denture, and they are well adjusted into the bone. They've got good bone support, and as you can see on the 3D rendering, we've got no bone exposure, and they can very well have ball and joint abutments or a arch bar connection for a stable implant placement. So this is the lower jaw. We'll send the implant planning report. We have placed an implant system which has the same catalog length as Neodent, so that our doctor can relate with the system they have. Thank you very much.